steady at about 52,000. So yes, we are a large health system. Largest in Texas. If you know anything about Texas, that's saying something. All right, want to get the next one, Ryan? So a little bit about who we are in terms of technology learning services. My team was created, Technology Learning Services was created out of these three teams. Our North Texas ambulatory arm has been live on Epic for, 8 years. And they had actually developed their own computer-based training modules. This worked out very well. Our HTPN clinics, our North Texas ambulatory clinics, are spread over a very large geography. So getting somebody to drive from Paris, Texas down to Dallas, that's about an hour and a half. And as you can well imagine, that was just a waste of time, number one. And number two, some of our team members share cars and they have childcare responsibilities. That just wasn't meeting the needs of the business. So boom, develop computer-based training modules. So that little pocket of our business, that little pocket of our training business, if you will, had computer-based training modules. Now we move to Central Texas. We have 51 team members. All of that Epic training was delivered in the classroom, instructor-led. But the geography challenge remained. If you're going to drive from south of Austin into Temple, where our classrooms are, again, you could be looking at a 90-minute drive. So although the business did it, it really wasn't a satisfier for the business. And then in IS, we had 15 team members, mainly our principal trainers. Now, in North Texas, our hospitals were on Allscripts until June of last year. We brought all of those hospitals live on Epic. Well, Allscripts training consisted of PowerPoint presentations simply provided by Allscripts. So the training wasn't nearly as in-depth or complex as our Epic training is. So North Texas, if you're hired into North Texas, you're going to work in one of our hospitals. It was simply, here's some PowerPoints, but there was a heck of a lot of OJT going on. And we realized that methodology simply wouldn't work with Epic. But there were no training rooms in North Texas. None. And I'm sure many of you have been working in healthcare for many years. The most valuable thing in healthcare is real estate. So you can imagine, as I go to these hospital leaders and say, hey, would you like to pony up some space so I can develop a training room? You can imagine what the answers were. Let's just say it was all in the negative. So my position was created to lead this combined team, taking from all of these parts. So you notice we started with 89 members. We are now down to 63. Those 63 team members support 52,000 Epic end users. So that's a ratio of 1 to 185, 1 to 125, 1 to 825. And as I like to remind my IS partners, their support ratio is 1 to 88. So they have one IS team member for every 88 end users. I have one team member for every 825. And we really wouldn't be able to maintain that ratio without our robust computer-based training library. So, Ryan, you want to go to before we leave, Ryan, I'm sorry, can you back up one more thing? Very important piece. You'll see our commitment statement in the middle of this puzzle diagram. So each of us at Baylor Scott&White Health is encouraged to have a personal commitment statement, meaning how every day are we going to get up and what is our commitment to the organization? What is our commitment to our members and to our patients? So when we think about developing this team from three very different areas, and in some cases, different cultures, Texas is one state, but many cultures. How do we all come together as one? One of the ways was to develop our own commitment statement, and this is ours. We commit to empowering the adoption of EHR-related technology so that patients and members are treated by the most proficient users in the nation. not proficient in the EPIC sense, it gets a little tricky there. We have our own proficiency continuum that we have developed. We're not going to cover it in this session. Happy to chat with you offline about that. But our proficiency continuum then walks people through what happens after new hire training. How do we get you proficient, and how do we maintain your proficiency? So I just wanted to point that out, because that is our professional North Star. That's very important to us. All right. So to answer the question, what is it that your team does? Get this question a lot, especially from executives in the organization who aren't new name title, right? New team names. Have to be able to answer that question. My elevator pitch. Well, our activities can really be divided into three broad categories, but we build and optimize the technical framework required to provide learning services and to deliver continuous learning and end-user support. So last year in 2020, we trained 37,337 team members. This includes new hire training. It includes cross-training during COVID. It includes some advanced training. So 37,337 end users went through some sort of training that TLS provided. And again, with those kind of numbers, we wouldn't have been able to come close to those kind of numbers without a significant uplift in our budget, so that we could add headcount and go rent some training rooms. All right, Ryan, next slide. All right, so what value do we bring to the organization? Really, again, proficiency is our North Star, professional North Star. Organization not going to come close to maximizing its investment in EPIC without having proficient end users. It's much like having a Ferrari and keeping it in a garage. Every organization, after they drop hundreds of millions of dollars on EPIC, their boards are asking, their C-suite's asking, great, now what? Well, the now what is, whether it's Baylor Scott&White or really any EPIC shop, it really all starts and ends with proficiency. Really, without it, if you don't have proficient users, you're not going to meet any strategic goal tied to your technology or tied to predictive analysis. We found that the more proficient our users, the higher our engagement scores, the better our retention, the better we're able to standardize our workflows, our processes. So for us, again, our success, that's our professional North Star. That's really where we are focused on. Now, one thing I do want to call your attention to is with CBTs, we spend 30% less time in EPIC new hire training versus instructor-led classes. And with the number of nurses that we onboard every year, we're easily giving well into seven figures back to the business, because we have quantified that. It's easily 30% less time with CBTs than instructor-led training, because we're not necessarily pacing our classes to that end user who may be struggling. It's whatever your pace is whatever your pace is. So obviously our CNO is very happy with that figure. All right, Ryan. Next slide.
All right. So, Georgianna, a couple of years ago, when you first started to convert to CBTs, you were in a little bit different place. And instructor-led training was the primary method across the organization. And many of the leaders on the call today might have some of the same challenges you did. Can you tell us about what really prompted you looking into alternative solutions to the instructor-led training classes?
Sure. Want to go to the next slide, Ryan? I think this is our Rhode Island slide. Is this our Indiana slide? There we go. So all of the blue that you see in the state represents our service area. And if you would, with the exception of what's in West Texas, if you really just focus on what's Central Texas and East, that geography is either 30 Rhode Islands or one state of Indiana. So if you can imagine, it's just not feasible to send a trainer to again from Dallas to Austin. I mean, that person's going to have to pack a lunch and a dinner because our roads are always under construction, number one. Number two, the distance. So geography was a significant business driver in our decision to transition fully to new hire computer-based training modules. And then really because of our size and because of the number of facilities and the number of clinics we have, the ability to deliver a consistent learning experience for new hires and new affiliates, we didn't at the time have an established super user program. So we really couldn't leverage super users to help define that consistent message. We have big geography, and we wanted to ensure as we all come on board with Epic, that there was a consistent message. So if you are in a clinic in south of Austin, Horseshoe Bay, you're hearing the exact same message that you are if you're in a clinic in Paris, Texas. Same, exact same. And so the hope then is that you at least initially understand, here's our common workflow, here's how our instance of Epic works before you dive into your job, if you will. And then again, I mentioned it before. So first one is geography. Second, ability to deliver a consistent message. And then third, real estate. No budget to build out training rooms. Nobody was going to give me training rooms, any facilities. No budget to add to headcount. Again, even when we had training rooms in Temple, Texas, had training rooms in Dallas, even that geographic spread was just a bit too much for our end users. And our North Texas ambulatory arm made it very clear we have CBTs, we're keeping CBTs. We are not straying from that. You are not taking our CBTs away from us. So really all of those factors, those four factors, were our initial impetus to going down the computer-based training route full-time, full bore. Yeah, and then efficient use of resources. Some of you may have, had budget reductions in the midst of COVID. I know I did. I took a 20% hit to my budget. But even before then, again, we were driving towards efficiencies. So how do we take scarce resources that again, I wasn't going to get a budget increase. So how do I in essence wring as much efficiencies as I can out of my existing resources? And that certainly was not going to be delivering in-person training. On top of that, we're on a quarterly release cycle. So the pace of change is rapid. And initially I thought, Epic says we're not going to have that many changes. They're not going to be that many. That has not been our case. And I would venture guess it's not yours as well. So in the ambulatory space, for example, we routinely have 400 changes every quarter, 400 changes. So how on earth, do you keep up with that in terms of not only getting your new team members up to speed, but your existing team members up to speed on that many changes occurring every 3 months. So again, we find it much more efficient to be able to leverage our CBTs, whether that's for new hire training and in some instances for quarterly update training, special updates, whatever the case may be. to help in that with that communication, then back to our end users. So our solution really couldn't be about what's best for technology learning services in the midst of budget cuts. Really, again, our professional North Star is everything we do, every action we take needs to lead to either getting an end user proficient or increasing that proficiency. But again, balancing the tools that we have at our disposal to make all this happen. So really, we need something that's scalable and flexible. Scalable so that this summer we plan on bringing on close to 1,000 nurses. Okay, I need something scalable so I can meet that demand and really meet it without without any consulting dollars, meet it without encountering any bumps in the road. Again, computer-based training offers that to me because really in a matter of minutes, I can have all of that curricula. As long as I have a clean list of end users, I can have all of that curricula assigned. Another thing I would point out is that during COVID, we were able to develop 31 cross-training modules, and we did this in a matter of hours, and we did it before the business even asked for it. So as we started shutting down surgeries, we realized pretty quickly that they're going to want to redeploy those nurses to other areas of the hospital. Tough to take an OR nurse into the ED. A little bit easier, so to speak, to take that OR nurse and send him or her to a med surg floor. So that's really where we started. And then on our own, we were able to identify 20 user roles that we had high confidence that the business would say, okay, we need to redeploy these resources. And then another 11 use cases were identified in the course of our COVID and then COVID recovery in terms of a business model. So again, I can't tell you how many Epic clients I've heard from during that period who were saying, "Holy smokes, what are you doing? How can we be as nimble and how can we be as responsive?" And really, at that point, if you don't already have something developed, I really didn't have a good answer for them. But I know COVID has definitely sparked a lot of organizations to start thinking about moving to a full CBT model or at least a blended model.
And speaking of the different models that are out there, not all. I hear a lot of e-learning, a lot of virtual learning, and really that can mean a lot of different approaches. I think that when we're talking with your computer-based training model, that really it's a highly interactive scenario-based online learning experience. So it's not passive. It's not watching a PowerPoint online. People are actually in scenarios performing duties that they would on a day-to-day basis. I think that's important to point out. And then you had also mentioned a little bit about blended learning. When we were talking earlier, and it's not a full blended approach, that different departments use it a little bit differently, and they blend based on their own needs and what makes sense in their area. Can you tell us a little bit more about that?
Yeah, so all of our providers are on a full 100% computer-based training for their new hire or new affiliate, and we only employ 39% of our providers. So 61% are affiliates, meaning they have a choice. They have a choice to practice in one of our facilities or go somewhere else. And some of our providers are coming here from other states. Actually, apparently we're hiring a lot of providers from New Jersey because I'll get a couple of phone calls from providers who are in the credentialing process. They're in New Jersey and they're able to complete their CBTs. They want to do it at 2 a.m., 3 a.m., whatever the case may be. And the feedback I've heard is, "Oh, this is awesome. I can get it done." And then, I'm in essence ready to go hit the ground running. So that's for our providers, full CBT. We partnered most closely with nursing education. So nursing education will take the curricula, the computer-based training curricula, and they have decided how, at what pace our new hire nursings will consume that content. So they'll do a little bit of CBT, they'll stop, they'll place what that nurse has learned in clinical context, maybe do a skills assessment, and then they'll start another CBT, place it in clinical context, do a skills assessment. That's what works best for nursing. Radiology is the same way. So it really, the benefit that we have found with CBTs is that it is grounded in simulations. It can be broken up very, very easily to meet the needs of all of your stakeholders in the business. And now we're empowering nursing education to say, take our content, consume it as you will, consume it at your own pace. If you need to, rewind and do something again, you're free to do that. In an instructor-led environment, we would have gathered all those nurses for a week, fire hose, right? You're going to learn everything we need you to understand about Epic. Then you're going to take a test, and then you're going to go to your facility, or then you're going to go to your clinic, and you will have probably forgotten 90% of what you learned. So now we're going to have to, retrain you. So that's how we found that the blended learning works best. But really, it's not me telling the business, here's how you're going to consume my training. It's me telling the business, this is available to you. You, the business, then decide what's best for you. And the business has been very, very receptive to that approach.
Hey, it's Lisa from South Coast. Can I just ask a question? At South Coast, we don't allow access to Epic until people are trained. So are you saying that you allow open access without any? I see, shaking your head.
No, they still have to complete Epic training. They still have to complete all of the curricula. It's just they don't have to complete all of that curricula on my timeline. They complete their curricula then on nursing education's timeline, for radiology's timeline. On the provider side, in order to be credentialed, you have to have completed your Epic training. So that takes care of providers. But in terms of nursing, you still have to complete your Epic training. You still have to pass an assessment. It's just I'm now not telling the business, hey, give me all your nurses for a week. We're going to run them through Epic. They're going to pass an assessment. It's nursing education now in charge of and really driving that bus to say we're going to have these nurses for 10 days. Why do they need to pass their Epic training on day 5 when they're not really even going to be hitting the floor until day 11?
Okay, I got it. Yeah, we usually It just we have a hard time with that, getting buy-in from operations for that, because most of the time they want them to have full access right away, which I guess is a limiting factor, which it seems that you've overcome.
Yeah.
Okay. Thank you.
Mm-hmm.
So going back to the projects that we were launching, there was a couple of different roles. Can you tell us a little bit about the way that we define the roles that would be involved in the conversion to CBT or computer-based training?
Yeah, and I will say this wasn't our initial thought. As Ryan can tell you, we went through a couple of iterations until we really figured out how to make this process hum. But first are your subject matter experts. These are credential trainers, end users. I would say for us, some folks on the informatics team for sure, and then the CBT authors. You want folks who are definitely familiar with Epic. Definitely do not need to be certified in Epic, but the higher degree of computer literacy, I would say, the better off that you're going to be in that particular bucket. And then instructional designers to really put that instructional design wrapper around it in terms of intros, the pace, the sequencing, really all of those factors. We have we have 4 people on our team. One of whom has a PhD in instructional design. The other 3 have their master's degree in instructional design. So we are very fortunate in that regard to have that knowledge on our team.
Great. And one of the keys, I think, and as you were saying that, looking back on it, we learned a lot through the process, and sometimes it wasn't moving as fast as we thought it should, and there were definitely changes that we made. But ultimately, I think this is one of the things that made that large amount of work, 144 courses in that 6-month period we had work, is that those roles were really, it was kind of an assembly line. Nick Edwards, from your team, says that it's the assembly line that made it possible. Yeah. And this is really what it looked like, is with the tools that you had implemented, there was something called the rapid recorder. So the subject matter experts were able to make the initial recordings for the simulations, and having them do that, and they're the closest to the work. So having them capture, I think, was really a large factor. And then that was passed on to the edits, where we started going through the simulation edits, which definitely is the longest process in the course design. Putting the bubbles in the right place, making sure that someone can complete those functions themselves. We actually did 3 modes where, they actually watched a demonstration, then they could do one without or with on-screen help, pointing them to the right areas, and then those hints were gone, and I had to complete it without the on-screen help. So we had those 3 different levels we put in initially. Then we assembled the courses with the instructional designers. Like you were saying, they're the people that took all the pieces and put it together, made it make sense. Kind of like a producer of a movie, is really, how does all this work together, and so that the learner has a good experience. And then there was the review process. Also the review process, Nick will say that took longer than expected, where you actually have to go through the entire course, making sure that everything is perfect, so that the end users have that great experience. Everything was done, and as it finished, it started passing through this process. So it took a little bit of time just to get ramped up. If you're going through a process like that, be prepared for that. Before things start coming out the end fully assembled, it does take some time to get the flow going.
Yeah, you're correct. And I would have a countdown on my whiteboard, and it stayed at 144. That's total number of courses we had to convert, and we had a fixed date, because our fixed date was the point at which we had to have a computer-based training new hire solution ready to go, because we were bringing on our largest facility in North Texas live on Epic. And so the week of go live, they had new hires. So we had to be ready to go. Went live on a Saturday. That Monday, we had to be ready to go with new hire training. And so it was, I would not recommend trying to do this in 6 months. It wasn't enough time for sure, but hats off to 314E. They were willing and more than able to make that journey with us, and found some excellent people that literally we would throw work to Ryan, and he would package it and give it back to us. And so yeah, Ryan, let's not ever do that again in that amount of time. That was definitely stressful.
I could 7 months would be great. So
7 months, 6 months.
I'll take 9 if possible.
Yeah, absolutely.
So here's a little bit on just the time frame that we were looking at, and just to talk a little bit more about the work that Georgianna is talking about. So the team did 3,303 workflow recordings in the 100-day time period. So we also edited each one of those and assembled into that multi-layer sequenced training that was hands-on. And we put it all into 144 courses. And the 44, that was actually towards the end of the project, is putting it all together. And we did that in 40 days. There was a little bit of nail biting there, but we were able to accomplish it and make that happen.
Yeah, so we use uPerform. And so as part of uPerform, you get Rapid Recorder. And so in the midst of bringing our largest facility live on Epic, implementing uPerform, and uPerform is not a it's not necessarily intuitive. It's going to take, if you're thinking about uPerform, it's going to take your team months to get comfortable with it. I still have team members today who will tell you they're not necessarily all that comfortable with it. So we had new technology, uPerform. We had massive conversion, plus the team was getting ready to take our largest facility live in Epic. So it was definitely, there were definitely some added stressors in there. This in and of itself would be stressful, but we had added stressors.
So we have the question on in the chat room to the SMEs recording the workflows, that screen capture recordings or audio recordings. So
yeah, it was screen capture initially, and then we identified some folks who we refer to collectively as the voice, and so we had folks who had just good voices for for some of these recordings. Some we just had to use the artificial voice, the robot voice, simply because there were too many courses in order to do the human voice for all of them. I will say we just signed with Amazon Polly, and their neural voices sound almost human-like, and it's incredibly low price point. So if any of you are looking for a cost-effective solution and you don't want to have to do the human voice, then I would suggest you look into Amazon Polly.
Mm-hmm. And Google also makes a similar product that is, and those voices have drastically improved over recent years. Yeah. So they're near human quality now. Mm-hmm. But for the initial recording, so the tool that you were using, uPerform, allowed the subject matter experts to make those recording. If you're using a different tool like Articulate or Captivate, then the way that we go about capturing that is we do a live WebEx session, and where the client actually walks us through their training, and then the 314E instructional designers then record that session, and then we go back and we replicate that. The instructional designers capture it with their tools, Articulate, Captivate, Lectora, inside the tool later on. There we go. So moving to computer-based training really impacted the work that your team was able to do, Georgianna, and took some of the, I would say, the day-to-day tasks, freed you from those so you could work on a little bit deeper training work. Can you talk about that? I think that was a big learning for us.
Yeah, so we are able to take many of our team members, and I will say this: I will caution anybody who's thinking of making this transition, is that if you've hired trainers, you most likely have hired people who want to be around people. They want to interact with people. So we did lose team members who said, I don't want to sit with my earbuds in and just do technology. Fair enough. So some of those folks, we were able to, find them positions within the organization. Others chose to leave. But for those who have a penchant for the technology, embrace it, dive deep into it, they absolutely love it. And so that's been great for our team. When I had to lay some folks off, a common refrain was, that I heard from people is, yeah, don't worry, because I'm going to get a job really soon because I now know how to create computer-based training modules. Amazon in Austin, Microsoft in Austin scooped up our people. I don't even know if they had more than a 5-minute interview, and our people were scooped up. Up here in Dallas, Chewy, scooped up our person. I think Neiman Marcus scooped up another one of our folks. So that was, those things stay with me. I feel responsible for my people. When I have to lay them off, those things stick with me. So that to me is a positive that will stay with me, because I'm like, whew, you guys found a job. But the opportunity now to not have people in the classroom, and now we can take a deep breath and say, okay, what advanced learning opportunities are out there? So we partner closely with nursing and blood administration. We have advanced learning pathway on that, and we've really taken our provider personalization, which Epic now calls user setting sessions, and we've really enhanced that into 3 distinct sessions that are incredibly detailed, incredibly meaty. And so again, I just wouldn't have had the bandwidth to really focus on more of those advanced learning opportunities if my folks were were in the classroom every day. So, and hands down, our physicians love our CBTs. I mean, they might not like having to go through them, but if training is a requirement, they absolutely love that they don't have to come into a classroom, and that they can fire up their laptop at 2 a.m. and complete them if that works best in their schedule.
Thank you. And lessons learned. Always, what are the pearls of wisdom?
Yeah, besides, what you have here on the screen, I will say that I hear from, some CIOs who are interested in making this transition, and understandably, one of their first thoughts is, awesome, I'm going to be able to cut headcount. Not necessarily, especially as you're getting this platform stood up. And then if you have UPerform, again, it's a meaty, complicated product, and it does take folks to keep it up to date. And I will tell you a tale of caution, perhaps. So we've converted everything. Brian and team did an awesome job, got everything ready to go in September. And then I called Casey in January, I think it was January, Casey, and I said, guess what? We get to do it all over again because of Storyboard. So we converted, and then when Storyboard came along, we converted again. And now I hear that Epic's going to change in-basket. There are going to be some substantial changes to the in-basket. It won't impact us as much as Storyboard. So that's a bit of a tale of caution that, always have in your budget when you can, consulting dollars to help with these kind of evolutions, because that is a heavy lift when you have to, when you have to totally redo your CBTs. But hopefully, there are not going to be that many more things coming out of Epic. Yeah, those are, besides what's listed here, those are my 2 biggest, lessons learned. And attract a team that is really, really going to, whatever technology you have, they're really going to embrace it. And you may need to be looking for a new skill set, and it's not necessarily, the person who has worked as a nurse for 20 years and then makes the transition to training. You may be looking for more of the technology folks, and then partner with informatics to really bring in that, the clinical pieces that you need.
Great.
Well, great session. As Ryan, you have on the screen here, if anyone has questions, by all means, please chime in. I do have a question for you, Georgianna. What would you say was one of the biggest challenges, either for you and your team to make this transition to CBTs, or for the organization to make this shift from in-person training to computer-based trainings?
Well, for me personally, it was the timeline. 6 months definitely just it wasn't enough time. So I would absolutely not recommend that. For the organization, we do still have some hiccups specific to assigning curricula for our affiliates. Mm-hmm. So in our all scripts world, again, it was really easy. Medical staff services would just literally send that attached PowerPoint to the providers and say, "Here's your training. Answer these questions," and away you go. So now medical staff services has to get into our LMS and assign training. So that's a bit of a hiccup that we're still trying to work out. I didn't necessarily foresee that as a challenge going into it, but that is indeed a challenge. And then just socializing the change in every communication channel or every pocket of the organization definitely takes time. So having a robust communication plan that really outlines not only the what but the why and the benefits, and what is what would your business partners expect to gain out of a computer-based training solution versus in person. And some of my business partners said, "Yeah, I don't want that. I want in-person training. Don't want anything to do with CBTs." And their reluctance was because, hey, look, I don't have space for these folks to complete CBT. So our solution to that is we do offer in Temple and in Dallas. We do offer, if you want to send your folks, we do have a space. We'll proctor them, so you can send them. We do offer virtual proctoring, which is basically a Teams, either chat or they can call in. And if they have a question about content, or even if they have a question about how do I log into my LMS, what am I doing, those kind of questions. So just be ready to support the business, be nimble, be flexible, that kind of thing.
Great, thank you.
I have a question, Ramon, Northern California. I'm spearheading a pilot program for launching CBT trainings, and they're not on board on it yet. I'm still creating one that's more to a department that they would like to see it with. I've already created some for laboratory, but they want to see one created for radiology. My question for you is, what style CBT have you felt has the biggest impact?
Definitely simulation.
Okay. With that, because I went down the same route. Currently, I build mine out of Captivate, and they're fully interactive in every which way possible that it can be. I'm now trying to tinker with fully interactive and game-based trainings.
Nice. Nice. Yep.
So with that being said, Captivate isn't really known for game-based training development. So do you have software that you would recommend to tap into that?
No, I wish I did. We're on the lookout for the same thing, because that's been one of the challenges I've posed to my team is, okay, what's next? So we have this, and I think the industry agrees that gamification can be a very effective tool in training, but I don't know if the industry really has a good platform to then create something that that can be easily gamified. So no, but if you find something, I would be very interested to know what that answer is.
Okay, last question. With developing these CBTs, and never mind, I lost my train of thought. There that went.
Right. Well, Ramon is looking for that question. We do have another one in chat. Did you see physician engagement scores improve
Yes.
after converting? And
Yes.
was proficiency with EPIC equal to ILT, instructor-led training?
So yes, on the physician and APP side, yes, engagement scores have increased. Not wildly so, but yes, they have increased. And then Ryan, what was the second part? I'm sorry.
Was their proficiency with EPIC equal to instructor-led training?
So we define proficiency differently. So if you're talking about EPIC version of proficiency, what you can get out of signal data and what you can get out of signal data for for ambulatory physicians, we do pull that data. We don't know that there's is causation there, but yes, signal data for providers, APPs and physicians going through CBTs is higher, better, however way you want to look at that, than our providers who went through instructor-led training for our North Texas EPIC implementation. Yes.
I think the data I saw was 16% improvement in the signal scores, but it's a pretty low sample size.
Exactly.
It's not statistically significant,
right.
But it is suggestive of performance.
Yeah, because we're just looking at our providers. So for our North Texas EPIC implementation, we did provide instructor-led training. And so we have that cohort, and now we have providers who are joining the organization, whether they're on the ambulatory side, they're all employed. And so now we can do that comparison. But to Ryan's point, yeah, our sample size is a bit low.
Okay, I remembered my question. In regards to assessments, since you're doing CBTs, are your assessments also scenario-based where they're going to have to complete it, or are they at the end of the CBTs, do they have like a questionnaire?
So on both. And so I'm going to give you two answers, my pre-COVID answer and my COVID answer. Okay. My pre-COVID answer is we developed something that we internally call RoboGrader. So do you know what EPIC's AutoGrader is?
No.
Well, there's not a whole lot of auto in the AutoGrader. Spoiler alert. So it takes a lot of time to build out an AutoGrader. Happy to chat with you and anybody else offline who's interested. So we've taken the AutoGrader concept and we've created RoboGrader. So if you want to test out, you would have RoboGraders assigned to you. So for example, we know that our providers in the inpatient space struggle with our discharge process because our discharge process isn't really aligned with our competitor in North Texas, even though we're both using EPIC. And so when they practice at both places, they don't. We know that's a stumbling block. So we have a RoboGrader that's basically we've taken one of our training environments and converted it into a RoboGrader. You're hitting that training environment and we're giving you just enough information. We're not leading you through, but we're giving you just enough information that you would need to then, in this case, discharge the patient. And then within a matter of minutes, it's graded, it's returned to you, it's returned to your manager. And step 2 in that, version 2 in that process is going to be, now we're going to attach tip sheets. So if you're a nurse and let's say you passed your RoboGrader, but just barely, and we've identified some knowledge gaps. Now we're gonna attach some links to some tip sheets, to help fill those knowledge gaps before you hit the floor. That's my pre-COVID answer. Post or during COVID, we went back to just our multiple choice exams because our nurses are completing some of their training at home, and we were just getting too many questions about Citrix. What am I doing? We just couldn't support that number of questions. So we're going to return to our RoboGrader version in July of this year, and when we expect those nurses to complete all of their training in a nursing education room somewhere. So,
are your trainings housed in within Epic as well? Like, so after a person passes the assessment and they get access to Epic, do they have an area in Epic to go back and retake those if they wanted to?
No, they could get into their Cornerstone is our LMS, and so they can always retake them in LMS. But no, we have integrated UPerform into Epic, so it's very easy for our end users to access all of our training content within Epic.
Okay.
Yeah.
Well, we are at the hour.
So we're at
No, that's
happy to meet with you offline and just walk you through what we've done.
Okay. Cool.
I'll be happy to make that connection for you, Ramon. And for everyone that joined us, thank you for attending. Georgiana and Ryan, thank you both for your time. Really enjoyed the conversation here. And at your agreement, Georgiana, I can connect folks to you if they have follow-up questions.
Absolutely.
Wonderful. Well, thank you all, and have a wonderful afternoon.
Thanks, everyone. Bye.
Thank you.
Bye. Just us.
All right.
I think that went really well.